Hello, everyone. Apologies for the delay. A reminder that technology is not always perfect. My name's Andrew Jack from the Financial Times, and I'm here with Dickie Settle from Path. And we're talking today about the Lancet FT commissioning on governing health futures, focusing on the issues around health tech, artificial intelligence, digital medicine, and really thinking about the issues not simply of the technology and the potential that it has to improve the lives of people around the world, but also the wider governance issues of data security and protection and privacy, and how technology can be used as a force for good to improve health outcomes globally. So the Lancet does a number of these commissions each year, bringing together leading experts to analyze the issues and to make policy recommendations. And for the first time, we partnered with them at the Financial Times in order to not only tap into leading scientists and medical experts and researchers, but also to provide a wider connection to policymakers and decision makers, including in business, and therefore to reach directly to organizations that are very actively involved investing and developing technologies with great potential. So with great pleasure, I'm going to hand over now for a short period to Dickie Settle, who was one of the commissioners, to talk a little bit about the process, the findings and reflections on the next steps over the next 10 minutes or so. And then hopefully for those watching, there's a facility to ask any questions or generate reactions. So we'd very much welcome that in the chat function here on the right. But Dickie, please, over to you to talk about the work of the Commission.
Thank you so much, Andrew. Well, it's been a really interesting and compelling time to be on this commission. We came together in 2019 in October, really to form the commission. And as you all know, it was just a matter of a few months later that we all went into lockdown for COVID-19. And this is unusual. Normally in a Lancet commission, and I anticipate what is anticipated for a Lancet Financial Times commission, the first of its kind, you would come together with the commissioners in various locations. We would visit different contexts, and we'd really work together to develop the report. And along with all of you, we were locked down into real virtual interactions, which really created a shift. It created a shift for us and how we needed to work. It really brought into sharp relief how digital transformation is affecting anything in so many ways. In our work at Path, I tend to focus a great deal on how digital transformation is affecting and addressing how countries can deal with health issues in an equitable way. And in so many ways, we saw a pivot in these last 2 years and saw how a health issue created the digital transformation of everything else and really accelerated that process. So it was quite the flip, and definitely cast the work of our commission into sharp relief. So ultimately, we landed on 4 key areas of recommendation. And number one is going to be evident to everyone after these last few years, is that digital is now very much a new determinant of health. Evident that those who have digital access are going to have opportunity for greater health. That can help ensure a healthier life. So definitely it's going to be really important for policymakers and in the very much focused on the need to come together as a world in having a coordinated and aligned response to health threats. Now, of course, the pandemic has us focused on short-term health threats, are now cast into very sharp relief by COVID-19, but also the longer-term health threats that are represented by climate change and other existential challenges to traditionally fragile health systems. And we really need to overcome a lot of the geopolitical challenges and be able to come together into a greater solidarity, particularly as regards to the data that can help us coordinate and align in a global effort to address some of these health threats together. One example right now is that the World Health Organization has called a special session of the World Health Assembly to focus on a pandemic treaty or other political concordance around a global response to pandemics. And, you know, among the many issues we need to look at is what's the appropriate actions and reactions. We see with the new emergence of the Omicron variant, all of the immediate travel lockdowns that happened. And in many ways, South Africa and some of the Southern African countries are feeling punished for having done the hard work of identifying and communicating the new variant and being as transparent as possible. These are the types of issues we're going to need to address together in our agreements with how we're going to communicate about health threats and how we're going to respond as a planet to health threats so that countries are not disincentivized from being as transparent as possible in sharing data about emerging variants or other health challenges. So that second one is data solidarity. So the third recommendation that's worth considering is, of course, at the global level, what's creating challenges are these issues of trust. But these issues of trust we've seen happening at all levels. We've seen such an incredible manifestation of the lack of trust that patients have with providers. We've seen the issues both patients and providers are having with health systems, and of course, different countries with each other in achieving that data solidarity. We need to come together and build a more individual rights-based approach that can really facilitate the kind of trust that's going to be essential to really be able to develop that data solidarity. We need to take the ownership of individual health data and help that it be within the hands of the patients, the clients, the population themselves, and then support them to be able to share that data for the global good as they wish to revoke the sharing of that data as they wish to, and to otherwise help ensure that they are really going to be engaging and sharing that data as much as possible. Now, what we're seeing, of course, is that's going to mean that providers, health systems are going to need to be more trustworthy and seem to be more trustworthy. And so we're going to need to come together to really think about how do we create that trustworthiness and build those architectures that can facilitate every individual to own their health data and to share that with those that they wish. So we've got digital as a determinant of health, greater global data solidarity, and the trust architecture that will facilitate that solidarity at all levels. And then finally, the fourth recommendation is around investing in countries to build that enabling environment. That means how do we help ensure the enabling policies that are going to help facilitate digital as a determinant of health? What are the capacities that every country needs in order to support effective digital health and health data? What are the infrastructure needs to reach the most rural and remote of communities to be able to facilitate the use of digital technologies? All of this was cast in a recognition that we've had a real gap around the world. If you see many of the policymakers who've been wrestling with the issues of digital transformation, they are many of us older, and not really taking advantage of the opportunities represented by the youth of our populations, the more digitally native of us. And so there's a strong message throughout the report that's calling for greater engagement of youth and other underrepresented populations as we design this digital transformation. Both take advantage of their greater comfort with digital technologies, but also their vision for the future. And of course, if we look to, as is often common in digital capabilities, the importance of designing with the user. Who are the users of the future but the youth of today? And so if we really are committed to designing with the users, then we need to engage those youth closely and carefully and ensure that they are part and parcel of that future that we are today creating with all of the decisions we're making together. Andrew, I think that's a reasonable summary of the highlights of the report. Is there anything you'd like me to focus on further?
No, thanks very much, Dickie. But well, let's see. You touched briefly on COVID. And of course, this has accelerated and brought to public attention so many of the issues that the Commission was discussing. I wonder if you might delve a little bit deeper into whether you think that sort of highlighted more benefits or more challenges, perhaps, and changed the way in which people maybe think about these issues of digital governance, whether it's around, the potential value, for example, of track and trace technology, but on the other hand, the concerns or maybe practical applications of uses or misuses of some of that additional genetic data and movement data and so on that we've been observing and have become much more integrated into our lives.
Oh, absolutely, Andrew. And that gets right to the heart of those trust issues I was speaking about. We've managed to create such a rift with the fragmented and piecemeal approach to data. We've shown very limited capability to address misinformation through social media. We've created so many conflicting narratives and echo chambers that have really created such a challenge. And we see such a substantial rift around the world with different populations, and it's really taken science, health itself, and greatly politicized it in so many ways. And so I think we're all still reeling with how COVID-19 and the information and how we share information, whether it's our personal information, whether it's countries sharing the identification of a new variant. We've created so many different issues and challenges with how information is shared and how we respond to the information that's shared, and to what degree we feel the comfort trusting that information that's shared and acting effectively upon that information. And so absolutely, as we were working on this report together, we were living daily the new challenges that are going to face us over the next 10 years and the years to come around how we're going to navigate these issues. And so the report very much calls on us to attend to these at the root cause level and to really begin to put the constructs in place that are going to help us address these challenges more effectively in the years to come.
And Dickie, one of the perhaps most interesting and sort of radical in some ways recommendations, it seems to me, is around this idea about precisely the kind of who controls and governs the access and the sharing of personal health data. And one thing that the Commission focused on and highlighted as perhaps an interesting way forward be around the idea of data trusts or cooperatives. Do you want to say a little bit more about what that would look like, and if there's any examples out there already that might be models?
Certainly. So the whole idea of the data trust is effectively a intermediary, if you will. It would be an organization that could really be focused on those individual rights that I talked about, and really ensuring that data that's shared is protected, that it's secure, that it's a place that focuses intensely on having strong trust relationships with individual patients, individual providers, as well as health systems at the national level and beyond. And done effectively, it can ensure that individuals have complete control over that health data and are able to articulate in partnership with that health trust who they're willing to share with, who they're not willing to share with, and make changes in those assertions over time, which is going to be really essential to give the individuals that power over their health data in order to, if without that kind of authority, if you will, then there's really no ability for them to enact that trust, and it effectively disempowers those individuals. And so by establishing a data trust at the national level, that's one way that we can begin to help ensure that power's in those individuals' hands, but also they are empowered to share that data for the greater global good, both at whether it's for their community, whether it's for their country, or whether it's for all the world. And so these data trusts are going to be a really powerful mechanism. And we've seen it, speaking to an example, in a few countries. Estonia, for one, has established a data trust and has established a set of protocols, approaches, and they've been building this for 20 years. This is not a quick fix. This is something that needs to really get established. I mean, the data trust itself can be fairly quick, but building the trust through that data trust capability is going to take some time.
And it sounds like we've got about another 10 minutes, Dickie, so we might continue our discussion a bit, but equally I'd invite anyone who's watching to use the chat function or the question function here to ask specific questions. But Dickie, that was very interesting, your point, for example, about Estonia. I mean, could you say anything more about how far after those number of years that they've been working on it in the country, the system has developed, and whether it's kind of proved itself in terms of greater public engagement and trust, and therefore wider public as well as perhaps private benefits from that more kind of e-based system?
Certainly. And what's important here is it's not just health. It's not just the health sector that's built this approach. Estonia has taken a whole of government digital approach to establishing these trusts. And there are certain elements here that are very important. For instance, a unique digital identifier for every individual, the types of enabling policies, the recognition that data does need to be individually owned, secured, and controlled. And so they've been able to establish this whole of government approach, of which health has really been able to be a key beneficiary and a key actor within this whole of government digital approach. And the way this works is that each individual has their own data stored locally on their mobile device. And for those who don't have a mobile device capable of storing that data, they have the data trust that actually stores that, but puts the control into the individual user's hands. And then the individual user is able to decide who they share it with, whether they share it, and take it away as that trust as needed for their own safety and security. And what they've done over time is just relentlessly demonstrated the trustworthiness of this approach, and relentlessly demonstrated how it works when an individual has control over that data. And over time, that's caused the individuals to share more and more, and to really see that value of coming together and contributing into the greater whole of the society. And so they've really emerged as a model for how other countries can help establish the trusts and establish those controls, and really, again, build that trustworthiness between individuals and the institutions that are there to serve and support them. So we're really hoping that this model is something we can continue to unpack and understand and help replicate around the world.
And obviously, a lot of the folks here at Giant will no doubt be from the corporate world. I mean, tell us about the evolving business models that could work around this sort of idea of a data trust. Obviously, it's a bit of an evolution from the classic model of services for free in exchange for full access to information for commercial objectives. How might that balance work? And do you see any examples already in the health space where there is a new equilibrium, if you like, between public interest and commercial interest that's sustainable financially?
Well, you've certainly targeted me to something I'm going to need to add to my repertoire of examples. Let me think about that while I answer your first part of your question.
I mean, I guess, sorry, go ahead. Go ahead.
Yeah, you might have a couple yourself you may have been thinking about from the Financial Times perspective. But in the first part of your question, one thing we're going to really need to do is to move away from some of the more extractive business practices that have really emerged, first from Google and then refined by Facebook, where, yes, you get an immense amount of services and value, and essentially you surrender in so many ways everything about you, your motions within the site, your use of the platform, and all of that data can now go into the sophisticated AI systems to develop an extensive profile of who you are and better and more effectively market to you and use that information from you. Now, we've seen with GDPR an incredible sea change in the tools and ability that you have as an individual to restrict and control some of that trust. But a lot of that can be pretty technically arcane and complex. So you have to do quite a bit of research to figure out how to enact those controls. But it's already getting to the point where we're seeing that there's a greater individual control over their data, and even on these platforms, and can restrict or make that available depending on the value that the individual determines that they derive, or the level of trust they have in the platform, or how much they're willing to share or surrender in response for the services and the value added. And so that's really going to put it's already started to and is going to continue to put some pressure on companies to be very articulate about the value provided in exchange for the data. It's going to need to be more transparent as private sector organizations as to what's being done with that data, the value that's seen in that data, and what is given in exchange. And it's going to need to be more transparently transactional, if you will, and really articulating and acknowledging that value. Some of the early practices, Google, Facebook, and others, was really to hide this, that they're even doing this, and to really try to keep the whole question of privacy and security out of public conversation. And now we're going to need to lean into it. We're going to lean into building trust with customers, delivering value to customers, and being really transparent about the value that's received in return from the data in order to encourage the individuals to choose to continue sharing and to build that trust with the different platforms and the different private sector entities.
Yes, I suppose one of the keys will be perhaps to recognize, as you say, you don't get something for nothing, and that then the key sort of model needs to perhaps find government or other healthcare providers to be paying for the services provided by any technological intermediary, rather than providing, as you say, sort of perhaps opaque level, which allows the tech provider to be extracting data for their own uses.
I think, yep, sorry,
go ahead. No, go ahead.
No, I was thinking, yeah, I mean, there's probably going to continue to be two levels, right? There are going to be those who are going to be able to and will choose to afford to pay in order to keep their data more restricted. And there are going to be those who want to derive that same value, but will need to use their data as a medium of exchange. But we need to just be much more open, transparent, and again, build that trustworthiness so people understand the value that they're getting and what they're going to contribute in exchange for that value.
The other thing, perhaps to briefly touch on in our final few minutes, is around interoperability, and I suppose the idea that there should be a finite period, and potentially then with competition or regulation and the opportunity to plug out of one provider or set of services and into another, let alone to aggregate health information of the public good between regions or countries. Any thoughts on how to develop standards that would allow that to be more friction-free and effective?
Well, you know what they say about standards, Andrew. There's so many to choose from. Unfortunately, that's a reality, is that we really have no lack of standards that are available, but we really need to align and converge on the standards that we're going to use. Certainly, interoperability, the use of APIs on a technical level. If you as a private sector entity are not already thinking about how you exchange data and your abilities to exchange data, provide access to your data, and also connect and utilize existing data resources, that needs to become top priority. We've talked a lot, and certainly in the report is very focused on the socio-political interoperability that's really going to underlie the technical, but we really are going to need to come together as industries, as consortia, in partnership with, in the health sector, patient rights organizations and others, to really align on those standards that are going to be essential and implement those standards. I've been working very closely with the World Health Organization, for example, in various health areas to establish digital adaptation kits that make clear recommendations for the kind of standards for interoperability. The ICD-11, for example, for more semantic interoperability on the terminology that's used, and FHIR, F-H-I-R, as the standard for really storing and exchanging data. And so as that work continues, WHO is partnering with Google and other entities. I know it's odd to say, oh, they're really challenging on the one side, but also really positive on the other, to really help articulate these standards and provide some very clear guidance for public and private sector alike as the types of standards that need to be adopted, and really provide the resources that are going to support that kind of adoption.
And then another technical area, I think, going forwards, which is of great interest and potentially concern, is thinking about algorithmic analysis, and particularly if you're, for example, a health regulator in a middle income or a lower income country, how, let alone the challenge for some of the richest countries in the world, how and what progress is being made around standards or approaches that might try to break open the opacity and really understand whether AI is ultimately moving in the right direction to generate, public benefit around health.
Well, it was really exciting to have Anurag Agrawal from India as one of our co-chairs for the commission. He's doing just amazing work on AI and the types of algorithmic approaches and assessment of algorithms and validation of algorithms. It's going to be essential. I've already been part of conversations with the World Health Organization, other health regulatory entities on how do we actually evaluate and qualify algorithms to really be effective. And this is really the most bleeding edge. And so for different companies, private sector groups who are listening to us today, if you really want to find a new opportunity that's going to be on the bleeding edge of these new trust architectures, how is finding ways that we can really evaluate, qualify, assess, and certify algorithms as effective, and then working with global regulatory bodies to help to put those put those recommendations into practice and be able to support countries to make good decisions around those algorithms. So very, very good point, Andrew, right at the edge.
Is there a key organization that people should get in touch with or be looking at that's trying to work on those standards?
I don't know of one that's clearly emerged at the moment. I mean, ultimately, it's going to be WHO as the global normative body in many ways. That's really going to guide all of the more regional and country-based regulatory authorities. But we'll be really looking over these coming years. There's a few groups that are coming up, particularly in relation to the pandemic. WHO has established the new Berlin Hub for Pandemic and Epidemic Intelligence. We're seeing the Global Pandemic Radar, the International Pathogen Surveillance Network, and genomics, such as identified the new pandemic variant. Rockefeller's formed the new Pandemic Prevention Institute. So certainly around the issue of the day, how do we function more effectively in a global response to health threats? We're seeing these emerging groups which are really going to be paying attention to these issues, especially with AI and emerging algorithmic. So these are some organizations to keep an eye on as they build a new global architecture for global response to health threats.
Just maybe, Dickie, 30 seconds left. Any final message, particularly to the business community, investors and others who might be watching today on what they might do?
I think it's only lift up, right? I mean, in so many ways, it can be easy to focus on the short-term issues of profitability, of survival in a continuously changing environment. And certainly that's understandable, but I think there's some value now in lifting up and attending to some of the global policy conversations, because they're going to radically shift what the markets look like, what the dynamics look like. There's going to be new regulatory guidance, as we've talked about. So take some time, read at least the executive summary of this Lancet Commission, Lancet Financial Times report, and understand where this conversation is going and how it's going to affect your industry and how you're going to navigate. Those who are better informed in these global policy issues are going to be more ready to compete effectively in the markets to come.
So Dickie Settle from Path, and one of the commissioners, thank you very much for those deep insights. A reminder, and you can see in the chat or Google for both the Lancet or the Governing Health Futures site, as well as coverage in the FT, and certainly a very much a topical issue that there'll be lots to write about and explore as we see this explosion in investment in this sector going forwards around the world. So thanks very much again, and thank you all for watching.